Okay, we're going to start on our HESI review right now, and so quizzes should all be done. What we're going to do is go over some information for the HESI. I wanted to just say before we started, were there any really big questions you have? I will tell you the HESI does run kind of med surgery, so we're going to go over some of those concepts tonight. But any questions about the HESI? Did everybody sign up for it? Good. You guys should be signing up with your campuses. If you did not sign up or you're having trouble, I want you to contact your dean at your campus. Okay? Do
How
not
do you sign up for it?
What's your campus?
Well, we're in Port St. Lucie, Florida.
Anybody else at Port St. Lucie?
Yeah, there's a few of us.
And nobody knows how to sign up?
It's through Evolve.
If you go
Okay.
to Evolve and with the HESI, where you would usually go to get your remediation, it should pop up there on that main.
Okay. Thank you.
Thank you. I don't know from my perspective, right? I only know how I do stuff. So make sure you sign up. There's like certain times, specific times based on your campus. So, you guys should all be ready to go there. Please make sure you guys have whiteboards. Do not bring paper. That it is not allowed. It'll be proctored as usual. What else could I say? You're aiming for an 1100. Everybody aim for 1100. Okay, there's remediation, which the guidelines were posted in the announcements, right? Sometimes I forget. But if you look in our announcements, we should have the remediation. So it's like 900, starting at 900 and above, you do like an hour, 802, 703, like that kind of thing. Same as all the other HESIs. Please make sure the remediation gets done in time, because if you don't do the remediation, as you guys know, you'll get a 0 for the HESI, and nobody wants that, because I will tell you a 0 on the HESI will fail you for the class. Okay, there was HESI handouts, right? Did you guys see the HESI guide? It's like 50 something pages. Ashley, you usually shake your head, so yay or nay? Yes. Okay, good. Thank you. I always know when people are hearing me because you shake your head, which is good. Thank you. I appreciate it. All right. So we have the HESI. I know it's like really cumbersome. What are you going to do with a 50 or 90 page, whatever it is? I know it's crazy, but that needs to be what we give you, because we really don't know as professors what they pick for each HESI. There will be case studies. Please know that. Next gen case studies will be on there. So just be prepared for those. They tend to be a little difficult, I know, right? All right, so we're gonna start, and like usual on my on my reviews, I do a little thingy so you guys have something to look at other than just hear me talk. But please stay on for the whole review for credit for attendance. I know it gets kind of lame, but we're gonna try to do this together and maybe ask you guys some questions. Hold on, I'm just pulling it up here. There is a lot of cahoots that we put out there for HESI, so check those out. All right, so we're doing our HESI prep for community nursing. So some topics we're going to take a look at, they'll be our next gen and HESI prep, right? All right, so essential topics. Community nursing students will get information on the nursing process, on client needs, foundational nursing concepts, and exam performance. So we take a look at the nursing process. We went through this many times in our class. It's our ADPI, right? Our assessment. What are some things that you're going to be assessing for? What do you assess for when you're looking at a patient?
Things that might be abnormal or like vitals or whatever.
Okay, vitals for sure. Anything abnormal? What would be abnormal?
We assess for the level of consciousness.
Hydration, skin color.
Good. You can sometimes just look at a person and know that they're off, right? Something's not right. So then once you look at them, then you have to say, what am I going to do? Now, when you plan, this is true for us all the way through nursing. You have to look at your audience. So when you're thinking about planning, I want you to remember who you're looking at, because if you're teaching or you're assessing a kid or you're assessing an adult, a couple bruises on the knee on a 5-year-old may be very different than a couple bruises on a 90-year-old, right? So think about that when we're planning. And then we implement, we put stuff into play, and then we do whatever we're supposed to do, and then we evaluate. Do we do a good job? What can we make different? Those kind of things, right? All right, so we're gonna keep going here. Oopsie. Can you guys see this? Is it big enough, or you want it bigger? So here's assessment. So we know this is crucial for establishing a baseline. We need a diagnosis and care planning. It's going to be subjective, what they say, and objective, what you see, right? To form a clear picture. Then we go to our planning and we set measurable goals and outcomes and collaboration with the patient and other teams, and develop a care plan there for that. Implementation, we're going to be the action phase. This is where we administer meds, we do treatments, we provide education, support to the patient and their families. And like we said, evaluation is our final step, where we look at the care plan and we say, were these good? Were they bad? How should we change this? What should we do different? What should we keep the same? Okay. We have comprehensive care needs and neglection, which I want you to be careful with. Neglect. We look at increased complications, patient dissatisfaction, legal repercussions, all that kind of stuff that's yucky. Key areas of focus. I want you guys to pay attention to this. I did tell you that it is med surg heavy. So we look at nutrition. We look at perfusion. How does everything get through the body? We look at infection, mobility, comfort, pain, and caregiving. Okay, so we talk about all those. When we're looking at understanding client needs, we're going to make sure they have a safe and effective environment, right? Management of care, we're looking at safety and infection control, health promotion, which was a big piece of your paper that you guys did, your PowerPoint. Psychosocial integrity and psychological integrity. So with our safe and effective environment, what are we looking at here? We're making sure that our clients receive the care in settings that minimize risks, promote healing, proper sanitation, accessibility, and supportive atmosphere. So think of those things when you're looking at our environment. We do management of care. So effective management of care involves organizing, coordinating patient care activities. So this is going to involve communication among our healthcare team. Safety and infection control, we talked about this with our infectious diseases, making sure we're using our PPE, we're educating on vaccines, all that good stuff. Health promotion, we're going to be, how are we going to make people healthy? Teaching about exercise, weight control, all those kind of things. We do psychosocial integrity, which addresses the emotional and social aspects of client care. So remember this when we're looking at that. And physiological integrity focuses on the body's actual physical ability to function, right? So this is where we look at our vital signs, our meds, and our physical needs. Here are the areas that got continue to get low scores. Fluid and electrolyte balance, metabolism, glucose regulation, and thermoregulation, which is going to be our body temperature regulating. So we need to think about fluid and electrolyte balance and understanding our acid base and how fluid and electrolyte is crucial for our effective care. We need to know about metabolism, so the knowledge of what is being metabolized, how does that accent one another with health outcomes. We look at glucose regulation, right? We think about where should that be? What does it do when your levels are high? What does it do when your levels are low? Thermoregulation, maintaining our body temperature for overall health and nursing knowledge and skills. Okay, so these are going to be some study strategies that we need to focus on. Nationally, they score very low. So core nursing concepts such as nutrition, safety, and infection control. We're going to engage with various resources, and you're going to practice exam questions to see how you do. Okay, so that was one presentation that I had. It's kind of an overview, and I know you guys probably feel that way, that it's just very vague. But unfortunately, the HESI is very hard to pick. So I have another little piece that we're going to look at, another PowerPoint that we'll look at. It'll be a little more detailed, but I want you to think broad spectrum. So when you guys are studying, I want you to be looking at that NCLEX book. You should have that turquoise book, right? And you know what I'm talking about? There should be a community section in there. You're going to go over those.
Actually,
There should be, because that's how most of the, maybe it's under something other than community. It's, you have your book handy, Ebony? If you go in the back.
I know it's not this one. You're talking about the blue one.
Yeah, the blue one.
Okay, hold on.
Anybody have the blue one close by? I don't think it's that one, Miranda. That one looks purple. Maybe they changed the book for you guys, but it used to be turquoise. No, Evelyn, that's not it either. So maybe they changed the book for you guys. So you guys have a different NCLEX review book, maybe? I think it's that one. No, not that one, Ebony. Look at Evelyn's. Evelyn, show everybody your book. Look and see if there's a community section in there. Doesn't look really familiar, but but what you can do is on any of your NCLEX review, if you see a community section, review your Med Surg 2 section. What else can you? Renee, I don't think that's it either, Renee. Maybe they gave you guys a new book, because that doesn't look right to me. It's like the whole book is turquoise, but what happens sometimes is we don't know that they change your book for NCLEX, so maybe.
So for
Do you see
I
any
know
community in any of those books?
no, there's none in either book. That's why I was also looking on the link through our student resources that has HESI, and
Yeah.
there's nothing there.
All right. Well, there's a bunch of HESI documents. Did you guys see those? I put that in an announcement. Did everybody see that? So those will be some documents that can help you there. What else? What else? What else? I was gonna pull up a PowerPoint to help you with, but major concepts are like age, we did this. I'll try to do a quick review here with us. Primary, secondary, tertiary. Of course, we know that to nauseam at this point. Prevention, right? All three of those preventions. Prevent, some screen and treat. And then we had our different things that Foster, are you with us? He's sleeping.
I'm sorry. It's
Wake up, bud.
in our NCLEX book, it's called Population Health.
Thank you.
It's in this one.
That one?
Mm-hmm.
Population health. Okay. Does
Yes.
everybody see that one? Natasha, hold that up for them again. Look at this book. It's like purple and a little turquoise in there. And she said it's under population health.
Mhm.
That would be good. You can also Google HESI community and you'll find some online. I wouldn't say that's great because we don't know who's writing the question. So it'll be just somebody making it up. You know what I mean? So let me try to pull up that other PowerPoint because I'm drawing a blank right now. But
How do you feel about like Quizlet?
I mean, I think they're good. Remember, we don't write the HESI.
Okay.
That's a national exam. So like the Cahoots are made by us, you know, us as instructors.
Mhm.
So it's what we think would be on there. We do have ways to know the content. So I don't
Okay.
think it's a bad thing. I would not solely rely on that though. I hesitate in even saying rely on it because I wouldn't rely on that exclusively. And the reason for that is because it is really what we think is important. All right, I'm gonna have to put another thing here because my PowerPoint's not opening. Let's see here. It's a lot of reviewing our concepts, but it overlaps. I can't emphasize this enough with your med surge too. So when you're looking for that, come on, man. My computer is misbehaving this evening. Ah, finally. Oh, now. Where did you go? Okay, so all that we review. So let's talk about diabetes. What should we know about diabetes from a med surg perspective? You guys tell me, what do you think's important?
Slow wound healing.
Say what?
For diabetes, slow wound healing.
Good. Slow healing overall. Good. What else?
There's a lot of at-home teachings that you need to be aware of, like setting the water temperature at a decent temperature, making sure that they have handrails if needed because they sometimes lose balance. They have tingling in the fingers and sometimes lose sensation.
What's that loss of sensation called? You're doing a great job.
Neuropathy.
Good.
Neuropathy.
That'll be neuropathy that you're thinking of, so we want to think about that. What else do we think about for diabetics? We're going to do home teaching. We're going to make sure, what do they do with their insulin?
That they take it as directed.
Good. Take it as directed. Make sure they refrigerate it if they need to. Right? Hold on one second. I'm just trying to get this thing. Okay. Gosh, this computer's slow today. Let's see what other kinds of things. Let's talk about
Glucose
hypertension.
checks.
Glucose checks, good. We're also going to make sure that we are having them visit their endocrinologist. What's that test called that we do?
A1C.
Good, A1C. What's the normal value for an A1C?
I think it's less than 7.
Less than 8.
Normal value
Yes.
is less for any type of person. For a regular person is 5.4.
Good. For a regular person, it's going to be different than diabetic. That's correct. So we want to think about that. Diabetics should be under 7 because that's an average, remember, of their glucoses. Okay. All right. Let's take a look at this PowerPoint and see if this will give you guys some more info. Oopsie. All right. So when we're thinking like a community nurse, we're going to think about how community care differs a little bit, right? From a hospital to a community. So for example, if somebody's got something cardiac going on, When we're in the hospital, we're worrying about managing our heart failure patient, right? But then when we're in community, we're like, what can we do to help them? So we're going to do some resources. We're going to prevent readmission, those kind of things. Social determinants of health takes us back to week 1. Remember this from Healthy People 2030. Education, economics, social context, neighborhood, and healthcare access and quality. We know changes based on income, right? So the lower the education, the lower their health outcome. Lower their healthcare access, the lower their outcomes. The economic stability, the lower it is, the poorer the outcome. We take a look at infants and children. Remember our risks of SIDS. We're going to do prevention with immunizations, safe sleep, injury prevention. Okay. With our adolescents, we have our leading causes of death are going to be suicide and MVAs, motor vehicle. So we're going to do prevention with substance use, safe sex, HPV education, mental health screenings, right? Women and men, when we look at them, women have a higher rate of heart disease, lung cancer, and reproductive health problems. Men have a higher rate of heart disease, cancers, injuries, and risk-taking behaviors. Men are more likely to take that risk and do something a little crazy. All right. And then, all right, how would we assess risks and abuse? Remember our risk safeties, falls, chronic illness, depression, our polypharmacy, huge among our geriatrics. With nursing, we're going to assess ADLs, abuse and neglect, promote safety, diseases you should focus on. Please pay attention to these. Hypertension, diabetes type 2, gastric bypass, which is a newer concern, CVA, COPD, and pneumonia. Respite care, we talked about, we had a whole chapter on that. Glaucoma teaching, right? And who are we teaching glaucoma teaching to? Who has a high rate of glaucoma? Anybody know?
African American.
Say that again?
Is it African American?
Actually, it's genetic. So those people, you're going to really do a lot of teaching if their mom had it. Oftentimes we see it repetitive among genes. And then diet and nutrition, we know what we're going to talk about. Abuse and neglect, this was a big section, a big trauma, informed care. We watched that little video. You're always going to assess in a private environment like we did in our case study. And nurses are always mandated reporters. Please remember that. We are obligated to report. And my rule of thumb on this for you guys is always over-report. If you have any suspicion, just report it. All right, our levels of prevention, we went through this real quickly. Primary, secondary, tertiary. We know where each fall. At this point, you've had several questions on that. That will be on your HESI. We had three different types of nursing that we talked about. School nurses, where they do our immunizations, they do our screenings and chronic care of our ill. And then we have our faith community nurses, which work in the spiritual context, right? Maybe not doing so much medical, but more health. And then we have our hospice nurses that we had a whole chapter on, and the quality of life, right? Family assessment, huge, huge, huge. Our eco maps is our environment, how we interact with them, our genograms, our genetics. So we're always going to check for all of those. We have neighborhood safety, child safety, elderly safety, and violence safety. Epidemiology, 2 big chapters we had on that. Remember our triangle with our agent, our host, and environment. Our vaccination, we're going to make sure we're targeting the agent. And community assessment to review our risks. Who's at risk and why? So remember, they work as a triangle. So if we think about the organism like TB, who's going to be more likely to get exposed to it? Those people with poor nutrition, low immunity, and concurrent disease is going to make them it's going to make them more susceptible. And then if their environment is poor, then that's going to help as well. All right. We remember surveillance, and we're taking a look at things like tracking. So when we surveil things, we look at where's the trends, who's getting it the most, the flu, and we report diseases to the CDC. Remember, we had active and passive surveillance that was on this last test. All right, we had disaster and bioterrorism. So disaster, we have 3 different stages. We prepare, we respond, and we recover. Triage, you have red, yellow, and green, and black. So triaging somebody, if they're immediate, they must be taken care of. They're going to be a red. And then we look at bioterrorism, like smallpox, anthrax, and Ebola. We spoke about ethics, right? And our 5 things: autonomy, beneficence, non-maleficence, justice, and mandatory reporting, and HIPAA. Make sure we're careful with our violations. Nutrition and health. We're going to do elderly diet. Make sure they're eating enough. Heart healthy. We're going to watch what they eat, watch for cholesterol, those kind of things, diets and stress. Promote healthy foods. Manage stress through balanced nutrition, not eating a ton, right? All right, chronic diseases. This is what we started talking about. Glaucoma, you will see here again. So our diabetics are definitely at risk for that. Retinopathy is another big one with diabetics. So we're going to make sure these are the kind of testing we're doing on them. We're watching their blood pressure. A lot of times they'll put a diabetic on a statin just to be a little safe. So monitoring A1C. We're making sure we do our BP on what arm? Do you guys remember? The right arm. Do it on the right arm and make sure it's level with the heart. All right, delegating tasks. I'm not going to go over this. You guys should know this by now, right? Nurses process, program planning, like an obesity program. We're going to plan for that. We're going to have our outcomes established. We want those to be lower obesity rates. All right, quickly. Which level of prevention is immunization?
Primary,
Primary.
Good. Leading cause of death in adolescents.
car accident,
Accidents.
Suicide and car accidents. Yep. First action in ADPI.
assessment,
Assessment.
Excellent. Triaging. Somebody with chest pain. Red, yellow, or green.
Red.
Red.
yellow,
Okay. Yeah, red or yellow. What I would say in that instance is if it's just chest pain, nothing else, no other signs or symptoms of concern, then we could do yellow on that one. And then the nurse role in hospice is just to do what?
Provide comfort.
Good. Provide dignity.
Comfort and pain
comfort.
management.
Don't worry about pain management. We're looking holistically here. Yes, you want them comfy. Why do you want them comfy? Because you're going to give them dignity, right? So those 2 things go together, right? So you're not wrong with pain management. All right, so I will let you know. Here's some final tips. You guys are going to do fine. Review your rationales after your practice questions. Trust ADPI and safety. So you're always going to assess first. And stay confident. Do not change your answers. Do not go back. Go forward. I've told this to many students. When you take a test, if you don't know the answer, but your gut says it's X or Y or whatever, go with the X or Y, whatever you go with. Because 9 out of 10 times, that's the correct answer. Okay, so get sleep beforehand. You can celebrate after. Just relax. You guys are almost done. It's been a pleasure to have each and every one of you. You guys have worked very hard this semester. And I thank you for that. I thank you for sharing your experiences and making this class a better community for all of us. So with that, I'm going to let you guys go. Not early, of course. I'm letting you go to study on your own. So you guys are going to study, okay? You guys are going to do great. Any questions, you know how to get me. Please text me. I will be in and out. I'm going to a wedding this weekend. So just text me and I can answer you, okay? But again, thank you for sharing this time with me. I wish you the best of luck. You guys have my contact info if you ever need me. So with that, take care, good luck, and I can't see you, and I'll wait to see you in the field.
Oh,
Thank you,
you.
Professor.
Thank you so much.
Thank
Have a
you.
good
So
one.
much.
Thank
Thank you.
you very much.
Thank you.
Thank you.
I have a question.
Yep.
So we don't have to do like the individual meeting with you.
Oh, I forgot.
Okay, so
Oopsie.
I just want to make sure I get credit for it.
Don't worry, you will. I will send out an email this week. What that meeting will look like is week 12. So next
Okay.
week we have HESI. Week
Right.
12, you'll meet with me for like 5 minutes individually. I'll send you out like a little calendar thingy with times and slots, and you can fill it out. And if none of those times work, then you just send me an email and we'll meet. I'm really flexible that week. It doesn't have to be Tuesday. I think I'll probably do Monday and Tuesday that week, because that way at least we can get credit
Okay.
for the week.
All right.
Thank you for reminding me, Dee.
Thank
I
you. No
totally
problem.
forgot. Have a nice night.
You too.
Thank you.